All right, so today I'll be talking about promoting physical activity for cancer prevention and survivorship. So, while this is most of this work, it was focused on figuring out how to, well, let me go back. This work is talking about understanding the barriers and things like that so we can learn more about promoting physical activity. So that's the first step before promoting physical activity is understanding the needs, the barriers and preferences, things like that. So this is just a little agenda of what I'll be talking about. First, I'll give a little bit about my journey to assistant professor, talk about my areas of research, talk a little bit about my previous work, and also give a little overview of my current efforts and my next steps. So this is my journey to assistant professor. And as you can see here, and as in the introduction, he kind of just went straight through and told you about how I started and where I am, but it's not linear, not at all. And I just want to go into that. So first I got my bachelor's of science in exercise science here at UAB. But during this time, I worked several different jobs, just trying to get a feel for what I really wanted to do. I came to UAB as a pre-nursing student, did like a clinical type thing and saw this guy with his head open. And I was like, yeah, this is not what I want to do. I really thought that I wanted to follow my mom's footsteps and become a nurse. I have several people in my family that are nurses, but that wasn't for me. During this time, I also worked as a athletic trainer for UAB football. I did that in high school as well, but I was like, yeah, that's really not what I want to do. So a little bit about my high school, why I wanted to do athletic training is because I did it in high school. But during that time, my father passed away from heart transplant rejection. So I got here and I was like, okay, pre-nursing, I can help. Physical therapy, I can help. So I went to physical therapy. No, that's not what I wanted to do. So I went on and got my bachelor's in exercise science. I was happy with that. So the exercise physiology part, I was in cardiac rehab at Spain rehab and loved it. Then my grandma died from cancer, her second bout. And I was like, yeah, I really want to focus on cardiac rehab, but I really want to see how to get people to get active, especially cancer survivors. So my grandmother, in her first bout, she had breast cancer. After that diagnosis, she became very involved in water aerobics. Very happy, very active. Then she became less active and she got leukemia. And that's what took her out. So while I was completing my master's in exercise physiology, I was like, okay, I can't help everybody. I can't help the transplant rejection folks. Well, not rejection, the heart transplant folks. And I can't help breast cancer survivors too. So I decided to passionately pursue breast cancer research. So during this time, um, I reached out to a mentor here and I was like, you know what, I really want to get into this breast cancer thing. So I ended up in a PhD program here in health behavior. And I was a T32 pre-doctoral trainee. And during this time, I focused on breast cancer survivorship, physical activity, and some rural adults. I'll get into that. And then I went over to Moffitt out there in Tampa, Florida. Loved it, worked on different types of studies, got a lot of exposure to different cancer types, breast cancer, upper GI. I worked with pediatric cancer survivors. It was a lot. Oh, and skin cancer as well. So then I came back here. So that's my journey to assistant professor, but I just want to show you that it sounds like I went straight through, had no barriers, but things really influence what I did and why I do what I do now. So I just want to make that clear. And also just know people tell you I did this. Again, it's not linear. So you might, have to figure things out and that's okay. So you'll eventually get where you need to be. That's just a little bit on that. So these are my areas of research, the main three. So physical activity, health disparities, and cancer prevention and survivorship. And I'm interested in the interplay of these different factors. And the populations that I focus on or have focused on are breast cancer survivors, rural adults, pediatric cancer survivors, and young adult cancer survivors. So young adult cancer survivors, just to be clear, are survivors that are diagnosed between the ages of 18 and 39. And breast cancer survivors here, when I say just adults, that's just 18 and up. So I'll start with the work that I did previously. And this was during my pre-doctoral traineeship and my PhD. Yeah, I was just a T32 with the NORC, and I was a PhD student in the School of Public Health. So my work during my PhD was in two areas of the cancer control continuum, the prevention phase and the survivorship phase. Now it's focused on physical activity promotion. And this is the model, the social ecological model that guided my work. So the populations that I focused on during PhD program were rural adults. So think of rural adults, well, think of rural as those areas that are geographically isolated. They don't really have much in terms of resources, like the nearest grocery store is like 30 minutes or more. Also, I looked into adult breast cancer survivors. But again, this model guided my work, and we looked into the intrapersonal level, which consisted of attitudes, behavior, confidence, and preferences. And on the interpersonal level, I looked into social support from friends and family. And then organization looked at the facilities and programs that they had available. And on a community level, looked at the built environment and the walkability. And lastly, looked into the local policies that existed. So the first population that I looked into were rural adults, and I'll go a little bit into that. So cancer prevention. So this is the part of the talk that'll be on cancer prevention. So cancer prevention, they say it's 3 simple steps. Just eating right, moving more, and staying lean. However, it's not so simple. So the areas that I have in this box right here are states that make up the Deep South. And those states are Alabama, Georgia, Louisiana, Mississippi, and South Carolina. These rates right here, these rates right here are the levels of adults that do not engage in any activity. I'm sorry about that. So the general, this percentage here for the US is about 25%, but you'll see below that all the states in the Deep South are higher or about the same, but I just wanted to highlight that there's differences there. But since I'm looking into rural adults, I wanted to just show you what the rural urban differences are. And you can see that little bit of a difference there, but it is significant. In terms of meeting guidelines, is anybody aware of what the physical activity guidelines are? Besides you two, y'all don't count. So there's some that know. So it's 150 minutes of moderate intensity physical activity per week, or you can get 75 minutes of vigorous intensity. So vigorous is that more heart racing type of activity, more strenuous. So just to highlight that, make sure you get your activity. So for the cancer prevention, there's a study, should be coming up to an end. It's called the DOW study, and DOW stands for Deep South Interactive Voice Response System Supported Active Lifestyle, the DOW study. So does anybody know what the IVR system is? Anybody know what the IVR system is? So when you call CVS, it says, thank you for calling CVS. Press 1 for this. This is what Pegmezzi, Dr. Dori Pegmezzi, she used that system to promote physical activity through behavioral counseling through the system. So the system will call them at a certain time each day based off of their preference and ask them, have you engaged in physical activity? Press 1 for yes, 2 for no. Have you had any barriers? Press 1, things like that. So it's just a bi-directional type thing. The system asks them things and they can respond with a number. And also this system gave them tips on how to get some steps in throughout the day, because in rural areas, there's not, much there. So how they can get it in throughout their day, even at home, like in their own personal home. So this study is, or about to come up to an end, in 245 underactive adults across these 6 counties. And I put a little pin there for the 6 counties, which are Sumter, Greene, Hill, Choctaw, and Dallas. So part of this, since we're trying to promote physical activity in a rural area, I led the efforts in the built environment assessment. And I used we used the rural active living assessment instrument. And this is a comprehensive assessment of 3 separate parts, but they all come together. So first is the townwide assessment, and then it's the program and policy assessment, and then the street segment assessment. And I'll go into which each of these assessments look for. But overall, this is just a few pictures of the things that we look for, like parks and playgrounds, area pools, pedestrian signs, speed limit signs, and the sidewalks and recreational facilities that existed in these 6 counties. So the time-bound assessment is looking at the things, and in this chart are the domains, like the school location. How far is the school from the town center? So think of the town center as when you ride through the town, it's like where everybody goes to pay their bills, or like where the local mail offices, things like that. That's the town center. So in relation to the town center, school locations, trails, parks and playgrounds, water activities, and recreational facilities. So those are all the things we looked at across those 6 counties. And also I'd like to note, this assessment was completed by a local rural county coordinator. So for this study, local rural coordinators are individuals that are trusted in these counties. So these are people that they're well known, and they know a lot about their county, and they really are really passionate about activity and things like that, and eating healthy. So they filled this out with the help of other town officials and things like that. And I just want to highlight these different scores and the points possible. And you can see here, out of all of these, the most prevalent thing that's around in these counties are, it's in the wrong spot, sorry, it's parks and playgrounds, which is under that. So it's about 20 out of 25 average across these 6. So that was the most prevalent thing out there. So that's something that we're, at the end of this lecture, I'll tell you about how we promoted that. And then think of these scores at the bottom as a grade 0 to 100. And you can see the scores kind of varied. Some are very, very low, and some are okay, kind of average. But if you look at the overall average right here, it's like a 50 out of 100. So you can just conclude that the town-wide amenities are not that prevalent across these 6 counties. As for the program and policy assessment, this was also completed by the local rural county coordinator. And this one looked into the town and school policies and programs. So town policy that I can think of from this assessment was, does the county shovel snow when it snows? Doesn't snow here that much. So no, there is no policy for that. School policy. After the school is closed for the day, can residents come and use the space for activity? That's just an idea. And then school programs, football, basketball, things like that. You'll see zeros there because this was completed in the midst of COVID-19. So this is based off of what existed during COVID-19. So you'll see a lot of zeros there. And again, you'll see here that the scores are pretty low, nothing really there to promote. And wow, everything's off today. But the total score down there is 24 out of 100, not too good. So as a street segment assessment, this was completed by me. So I rode around with another research member. Again, this is in the height of COVID. So we had an SUV, somebody's driving, I'm in the very back. And I had this clipboard and I had the paper assessment, and I'm going around looking for all these different things. Stop signs, sidewalks, are there buffers? Does the streets connect to something else? Are there any street lights? What is the land being used for? It's so much, but I made this super, super simple and very focused on what we found in terms of facilitators and barriers. This consisted of 96 street segments, and think of a street segment as from one stop sign to another. Mailbox 205 to mailbox 249. Those are street segments. I did 96 of those. It wasn't just one pass down. It was going back and forth till I figured out what was there and what was not there. And that was over the 6 counties. So each county had 16 street segments. So what did we find? Overall, the things that were kind of supportive of physical activity were sidewalks, shoulders. Think of shoulders as the little space on the side of like a street, a little bit, shoulders, and then connectivity, meaning that one street went to another. So you can see that's pretty low across these counties. The percentages are low, but those were the facilitators for physical activity walking in those areas. As for the barrier, top barriers were like the crossing signals, the pedestrian signs, public lighting, and speed bumps. And those are important because you don't feel safe if those things aren't out there. And some people don't even feel safe with the things out there. So I just wanted to highlight that. So these are the highlights of everything I just said. So parks and playgrounds were the most available amenity. Facilitators were the shoulders and the sidewalks. As for barriers, those signs and the public lighting were the top barriers. And this is the infographic that we mailed out to the participants that participated in the larger study. So we're all about promoting physical activity. So we wanted them to know what existed in their county, but we also wanted them to know what existed in counties near them. For instance, one county is probably like a 15-minute drive from another. So if you know the next county has something that yours doesn't, just drive over. It doesn't sound as simple, but we just wanted them to know. And also we highlighted in here what our next steps are as a part of the DAO project. And we gave them a little QR code down there to guide them to the paper and let them know what we found. This is very important. So once you do your research, you don't want to just leave. You want to stay in contact with the participants and let them know what you found. They actually love stuff like this. So the first part that I talked about was the built environment, what supports were found in the environment, and also some of the barriers. But again, we're focused on the promotion of physical activity. So there have been several behavioral interventions tested in rural adults with obesity. And one study showed that those with a higher BMI or obesity were less successful, meaning that at the end of the intervention, those without obesity had more minutes of physical activity versus those with obesity who had less. So this kind of implies that adults with obesity might need a little bit more intervention. So what did I do? I conducted with my team a systematic review to identify the barriers, facilitators, and preferences in the rural adults with obesity. And this ended in 10 studies. Of course, we started out with over 2,000, but ended up with just 10 studies. And very quickly, what did we find? We found that physical environmental barriers, building on that last paper that I told you about, were the top barriers for rural adults with obesity. And then there were some other things that emerged, like time, depression, social support, and some physical challenges that were barriers. And as for motivators or facilitators, physical activity trackers, most of y'all probably have one on, the little Apple Watches. Those are great. Yeah, they felt like those were facilitators, help them regulate and monitor their physical activity. And then being a part of a group, social interaction, along with a history of type 2 diabetes. That emerged in one paper, and so did motivation for weight loss. But the motivation for weight loss, I won't forget, was in a sample of white and African-American women. And women, the African-American women were more motivated for weight loss than the white women. So I just wanted to highlight that. And as for the preferences, this was the least assessed. Only one paper looked at this. And rurality, when they looked at rurality versus obesity, rurality was associated with preferring a web-based delivery. Think of that as like a website. And then individuals with obesity preferred face-to-face, so an in-person type thing. So I'm gonna kind of turn and go to another population. So going from rural adults to breast cancer survivors. So this is a figure that shows the cancer survivors versus those that don't have a history of cancer that report no physical activity. And you can see it's a bit kind of similar, but you can also see that for ages 45 and older, the no physical activity is a little bit higher in cancer survivors. Even though they're similar in the rates there, it's important to just know that cancer survivors have a higher risk of a lot of things compared to those without cancer. Comorbidities and just their life is just different after cancer. So very few meet the physical activity guidelines. Remember, physical activity guidelines is 150 minutes per week for moderate and 75 minutes of vigorous, along with resistance training, which I forgot to say earlier. Y'all didn't call me out, but the resistance training as well, at least 2 days a week. And very few have a healthy BMI. And a lot have a low cardiorespiratory fitness level, which is like the uptake of oxygen and how your your respiratory kind of how healthy it is. Best practices for getting this population to be more physically active, consist of theories and considering their preferences. But it is unknown how preferences may vary by level of obesity. So I did a secondary data analysis into my mentor, Dr. Laura Rogers' completed physical activity study in breast cancer survivors. And I just want to highlight their some of the sample characteristics. They're about 55 years old. Most were Caucasian, but there's a little representation of African American there. And the BMI, most of them were obese or had obesity. The months since diagnosis is about 53 months, and most of them had a history of chemo and radiation. And number of comorbidities, comorbidities are multiple chronic diseases. They had at least 2 on average. So think of that as like obesity and hypertension, or obesity and, I'm drawing a blank, just 2 chronic diseases. So these are the things that I looked into. So I looked into the BMI as a continuous and categorical variable, and I looked into these different, the relationships with these different variables. So BMI with physical activity and the physical activity preferences. So the source, think of the source as who you want to get this information from. Exercise physiologist, you want to get it from your doctor, like that's a source. The mode, structure, location, these are things like, do you want it as supervised, not supervised? Do you want it in person or not? Like web-based things like that. Location, where this was a big option right here. So you can do it at home, outdoors, at the cancer center, like a recreational facility like the YMCA, places like that. The distance that you're willing to drive to engage in activity, the price you're willing to pay, like for a membership, and program type, whether you want it to be cardio, resistance, or both. Supervision, if you wanted somebody to supervise you or not, and if you want to do alone or with a group. So these were some of those preferences. And we looked into cardiorespiratory fitness, which was a VO2 peak. And we looked into social cognitive theory variables, which were exercise barriers interference. Just think of that as just your barriers to engaging in physical activity, walking, confidence, barriers, confidence, outcome expectations, the good and the bad that you associate with participating in physical activity, outcome, I said that, and total social support. So that's from friends and family, those 2 sources. And what did we find? The relationship between BMI and physical activity. Physical activity, it varied by BMI, nothing significant there. This also, preferences did vary by BMI, but there's one preference that emerged as significant, and that was those who preferred to exercise at a facility had a higher BMI. And also for cardiorespiratory fitness, there was an inverse association. The higher the BMI, the lower the cardiorespiratory fitness. Low cardiorespiratory fitness is not good. Social cognitive variables, there were significant differences in walking confidence and negative outcome expectations. So we looked a little bit further into that difference, and you can see here that there was an inverse relationship with walking step efficacy. The higher the BMI, the lower the confidence in walking. And then for the negative outcome expectations, the negative things you think about when engaging in activity, that kind of varied there. And there's not a trend there that will tell us like, oh, well, this makes sense why this group has a higher negative outcome expectation. So we kind of had to speculate. So we speculated that maybe those with higher BMI, since they're maybe not as active, they don't have negative outcome expectations because they really don't engage in the behavior. So after I left UAB for the 3rd time, after I left UAB after completing my 3rd degree, I went to Moffitt Cancer Center in Tampa, and I completed T32 from the NCI. And I worked with Tiffany Carson, and I had a kind of a joint appointment at the University of South Florida, which sits on the same campus as Moffitt. And I worked with someone named Marilyn Stern. So, as I highlighted earlier, I worked in a lot of different populations while at Moffitt, and I didn't want to, talk about all the different things that I did. I just wanted to be focused on one. And I really enjoyed working with this group here. So I'll go into that. So just briefly, pediatric cancer survivors have a higher rate of obesity compared to the general population. about half don't meet the physical activity recommendations. And some of the barriers that are frequently reported by this population are physical limitations, fatigue, lack of social support, and medical factors. Think of that as like the type of cancer they had, the type of treatment they had. But a point that I need to make for this is parents and caregivers influence children's physical activity because they act as role models and motivators. If you think back to your childhood, if you wanted to do sports, you had to ask your mom, you had to ask your dad. They were the individuals that let you do the things that you wanted to do in terms of like sports or whatnot. So if they don't allow you to do things like that, you won't, get the opportunity to be active. And also, if you see your parents sitting on the couch not doing anything, you're going to do the same thing. So they act as those role models and motivators. But when it comes to the previous literature or existing literature, there's mixed findings on the relationship between the child and caregiver physical activity in the general population. But in the relationship between child and caregiver in terms of pediatric cancer survivors, those studies relied on self-reported data. The data that I'm using for this study right here, they used objective measures. So think of objective measures as like a fitness tracker, like I don't know if y'all know about the little actigraphs that studies wear on their hip, the little red things, but those are objective measures for physical activity versus relying on what I say I did. So that was the strength of this study, and that's why I really wanted to look into it. So the participant characteristics, just a few I want to highlight. They're about 10, 11 years old, and they were mostly female. And at the time of diagnosis, they're about 4 years old, and they got, most of them got or completed chemotherapy. And I just wanted to highlight here that this population was obese, had overweight and obesity. And just wanted to put the percentiles there because I learned in this study that it's not the same as humans. Not humans, adults, sorry about that. So I've always worked with adults. So I went to go calculate the BMI for these kids. My mentor was like, no, they don't have the same thing as you. And I'm like, what do you mean? So I just wanted to highlight that for people that didn't know that children and adults have different BMI like ranges, levels. They're calculated different. So yeah, know that. Don't do like I did. So as for the caregivers, so this study was a dyadic study. So it was the pediatric cancer survivors and their caregivers. So the caregivers were about 42 years old, mostly female, had a income over 70,000, and most of the caregivers were parents to the pediatric cancer survivor. And as you can see here, their BMI, which I was aware of, is in that obesity range there. So what were the factors that impact the physical activity among this population? So we threw in some things, we looked at some correlations, and the things that emerged as significant were the time since treatment, both the caregiver sedentary and minutes of moderate to vigorous intensity, and also the fact that their weight changed since COVID-19. And again, something I did not highlight about this was this study was conducted during COVID as well. So what emerged as significant what emerged as factors that impact physical activity among this population: income, radiation, and the caregiver MVPA. So that is something that I hypothesized was what your parent does impact what you do. So we did find that. So I went all over the place and I talked about so many different things, from built environment to rural adults with obesity to breast cancer survivors with obesity to pediatric cancer survivors with obesity. I was like all over the place, but I want to be focused and show you where I am headed from that to now. So first I want to understand the barriers, facilitators, and preferences of older breast cancer survivors. That's my task number one, is to figure that out. I've looked into the barriers, facilitators, and preferences among breast cancer survivors, but that wasn't older breast cancer survivors that are 65 and older. So once I kind of get a grip on that and understand, I want to work on working toward developing an intervention for this population. There have not been a lot that have done in this population as in terms of intervention. So I kind of want to do more on that. And then eventually, once I develop that, test the feasibility and acceptability of that. And like I just said, I went all over the place. I've had the opportunity to, work with a lot of investigators and work with different populations. While I have enjoyed working with all these different populations and learning about them, I can't stretch myself that thin and try to become an expert or someone that's well known in something if I'm trying to work on all these different things. So I will be moving forward with the breast cancer survivors, the older ones, and why I want to. It's important to me to be passionate about what I do. And when I come to work, I'm happy with what I do because I know why I do what I do. So that's my grandmother on my mom's side, the one with the that fought breast cancer, the one that fought leukemia but didn't beat that battle. This picture is of us after she finished her chemo. I have her wig on right there. And I just wanted to take a picture. So that's why I do what I do. I really love what I do, and I hope it shows that I love what I do. So I will be focusing on breast cancer survivors and trying to get them active. I want them to not end up like my grandmother, getting that second cancer. I want them to become active, stay active, and reap the benefits and decrease their risk of all these other, comorbidities. So that's why I do what I do. And I just like to acknowledge all the people that have had an impact and have worked with me as a PhD student, a postdoc, and even now, some more should be on here, but these are some of the people, and also all of the funding that I've gotten from the right side, and these different programs I've had the ability to go to, and then give me feedback on different grant applications that I've put out. So just want to say thank you to everybody on here and those that know their role in my research. So thank you very much.